Welcome, everyone. I'm super excited to have you all here. Thank you all for joining us this afternoon for our panel discussion on what labor has got to do with immigration. My name is Carla Gutierrez, she, her pronouns, and I am one of the program coordinators here at the UC Berkeley Labor Center. Before we get started, I want to give a thank you to the Labor Policy Group at Goldman for being a co-sponsor for this event, and also a big thanks to our team, Kirsten, Van, Sandy from the Labor Center, and Anna Fox Hodes from IRLE on their support to put this event together. And of course, the panelists and our moderator today, Dr. Anibal Ferris-Camelo, who I will introduce shortly. So we wanted to put together this event for a few reasons. One, for you all to learn more about some of the amazing researchers here at the Labor Center and the work that they've been doing these last few years, but also for us to discuss how each research team has discussed and analyzed the conditions and policies that impact the nation's immigrant communities, and looking into the intersection between immigration and labor. We'll have room for Q&A towards the end, so please feel free to add in your questions in the Q&A box that you have available at the bottom of your Zoom screen, and we'll go ahead and direct those questions towards the end to the panelists. So without further ado, I would like to introduce our moderator for this event, Director of Community Engaged Academic Initiatives here at the Labor Center, Dr. Anibal Ferris-Camelo.
Thank you very much, Carla, for organizing this panel. And I'm so excited to be able to interact with our experts on various topics here at the Labor Center. We are also very, very eager to reach a student audience of undergraduates and graduates to educate, mentor, and connect you all to the labor movement through the research that is being done at the Labor Center. Our panelists today are engaged in cutting edge initiatives that cut across issues issues that are also very important for us to be able to dive into. And we are carrying out the university's public mission, as well as the strategic initiatives of the university, by uplifting the voices of working class communities of color. So without further ado, I would like our panelists to say a few words about the work that you do and your role at the UC Berkeley Labor Center, starting with Pam Egan.
Thank you, Anibal. Appreciate it. And thanks to everybody for coming and listening today. My name is Pam Egan. I direct the Labor Management Partnerships Program at the Labor Center. Our primary focus has, in the last couple of years, has been on high road training partnerships, working very closely with the public workforce development and economic development system in California to lift up communities to increase the health of our economy from a climate change perspective, and to improve job quality.
Thank you, Pam. Dr. Enrique Lopezlira.
Thanks, Annabelle, and thank you to everybody joining us today. Yes, I'm the director of the low-wage work program at the UC Berkeley Labor Center. My name is Enrique Lopezlira. I'm a labor economist by training, and at the program, we conduct a wide range of research on low-wage work in California and the nation. And we particularly focus on documenting and understanding the conditions and policies affecting women, workers of color, and immigrants. Because the pandemic hit specific industries more than others, like leisure and hospitality, which has a large percentage of low-wage workers, we've really spent the last year and a half trying to understand the impact of the pandemic on the work outcomes and the economic outcomes of workers in those industries, and immigrants are a big part of that. And undocumented immigrants also part of that, and the data is a little harder to get for those workers. So we've also been trying to understand better their conditions as well during this time.
Thank you very much. And next is Laurel Lucia.
Good Good afternoon. Thanks everyone for being here. My name is Laurel Lucia, and I'm the director of the healthcare program at the Labor Center. Our research on that team focuses on health coverage and healthcare cost issues for California workers and their families. And one big focus of our research has been on access to healthcare and health coverage for California immigrants, and particularly the exclusions that they often face from health coverage programs, and the potential state policy solutions to close those gaps.
Thank you very much. Next is Dr. Nari Rhee.
Hi, I direct the retirement security program at the UC Berkeley Labor Center. So most of this work focuses on really the lack of retirement security for most workers in the United States, particularly focusing on the retirement wealth gap by race, by class, and by gender. Also starting to work on care work, right? So, and immigration kind of intersects with both of these issues in terms of the kinds of workers who are least likely to have, retirement benefits, who are most likely to have to work very long lives because they don't have retirement assets, tend to be workers of color and immigrants. And also looking specifically at undocumented immigrants and the various ways in which they're excluded from the national system of retirement security.
Thank you very much. All of you have already started touching on the intersection of labor, workers' rights, and immigration, and immigrant rights. But can you say a bit more specifically about why this intersection is important for us to look at in terms of policy, and how the immigration policies affect workplace rights and conditions for all workers? In other words, why should US-born workers care about policies related to immigration? Shall we go in the same order? Thank you, Pam.
Sure. So first, there's an extraordinary richness in embracing our fellow human beings as workers. And I think at our best, the labor movement understands that. But if you want to look at it from a pure perspective of economic self-interest, right, three things leap to my mind. First, our economy relies on the work of immigrants. Our economy doesn't run without immigrant workers, both documented and undocumented. For example, nearly 3 in 4 undocumented workers are essential workers. Imagine our having tried to get through COVID, through this pandemic, without the work of our immigrant brothers and sisters. Most of us probably couldn't get through a typical day, right, without relying on that work. Second, policy that elevates the status and well-being of immigrant communities elevates the entire economy. The Center for American Progress recently estimated that if we created a path to citizenship for all undocumented workers in the United States over a 10-year period, we would increase our gross domestic product by $1.7 trillion in that 10 years and create almost 500,000 jobs. And not only would we raise the incomes of those immigrant families, we would raise the incomes of all working families as a result of that activity. So pure economic self-interest. And third, if you think of economic outcomes as being driven by a basic power equation between workers on one side and capital on the other, anytime you exploit a worker or particularly group or class of workers, you weaken the power balance on your side of the equation. And anytime you strengthen a worker or group of workers, you strengthen the power balance on your side of the equation. I say your side because most of us are workers. Most of us, that's our side of the equation. It certainly is mine. And so having the power to change economic outcomes relies on that balance. So those are just three sort of basic pieces that come to my mind.
That's great that you have pointed out right at the start the power imbalance in the workplace as well as in the economy. Enrique?
Thank you. So I'm going to sort of break your question into the three parts, and I also wanted to tie it a little bit to history because I think history is important. So, what does labor have to do with immigration? Immigration is a key component of the U.S. labor market, like Pam said. It always has, it always will be. Our economy has relied on immigrants throughout its history and will continue to do so. We simply do not have enough domestic labor to produce all the goods and services our economy requires. So for example, look, historically, the Immigration Act of 1864 was enacted to address labor shortages during the Civil War and due to the Civil War. And the act made contracts for immigrant labor that were formed abroad enforceable by US courts because we needed labor during that time. Another example is the Bracero Agreement of 1942, which was in effect until the 60s. That was an agreement between the US and Mexico to permit Mexican nationals to serve as temporary agricultural workers during the shortages caused by World War II. So immigration and labor have been tied together for a long time. So the second part is, how do the immigration policies impact workplace rights and conditions for all workers? Again, if you go before World War I, immigration was in the US was virtually unimpeded. The great influx of labor that occurred in the 19th century from Europe, like Pam said, contributed to great economic growth and to rising levels of per capita income, or the way to think about it is our standard of living, right? So the flow of immigrants was slowed by World War I. And then we started passing restricted immigration acts in the 20s. These acts started establishing quotas for various nationalities based on the number of foreign-born people in the United States on census years. So we started getting our policy more restrictive around immigration. And then we started using that policy to discriminate against various groups of workers, right? You had the first Naturalization Act in the 1700s excluded non-white people from becoming naturalized. It actually said the applicant must be a free white person. It was amended after the Civil War to extend that eligibility to African individuals of African nativity or descent. But then we also use other policy like the Chinese Exclusion Act to discriminate against Chinese workers. And so immigration policy has been used to discriminate against various groups of workers. And it's not just legislation. You can also use executive action or rules by departments to either improve worker outcomes or restrict worker outcomes to some groups. So for example, a good action to help workers through immigration was the deferred action for childhood arrivals, DACA in 2012. That was executive action by President Obama, and it gave young adults who were brought into the US illegally as children to apply not just for deportation relief, but to give a 2-year work permit and allow them to work legally in the United States. But then you had the Trump administration changing rules through their Department of Homeland Security. They changed the public charge rule. This was a rule that would make it harder for people to become legal residents if they benefited from some government assistance program. It used to be that non-cash assistance would not exclude you from that, but then the Trump administration tried to change the rule so that if you were taking Medicare or Medicaid subsidies or federal housing subsidies or food stamps, now that would also impact your possibility of becoming a permanent resident here. And of course, the Biden administration reversed that earlier this year, right? So those are ways that immigration policy can either make it more equitable for all workers or make it less equitable for workers. And then the last part of your question about why should US workers care, what Pam said was spot on. Immigrants are a large part of the US fabric, right? According to the Pew Research Center, 44.8 million foreign-born people live in the United States, about 13.5% of the population. Like Pam said, they provide significant contributions during the pandemic, essential workers, like Pam said, about 5 million of those workers were estimated to be undocumented workers who were doing jobs that the Department of Homeland Security categorized as essential to the nation's critical infrastructure. And like I mentioned earlier, you saw this during the unimpeded immigration of the 19th century. The US GDP per capita grew substantially during that time. So our standard of living improves as the conditions of immigrant workers improves. And also our national security, because thousands of immigrants join our military every year. There's a number of non-US born soldiers serving in the military. So those are some reasons why they should care.
Thank you very much. And I'm glad you raised the question, the issue of public charge as well. This segues very well into the next lens on the intersection between labor and immigration. Laurel?
Yeah, Pam and Enrique, I think, covered really well in terms of all three questions. Maybe I'll just add a little bit from a health care angle. So in terms of healthcare, one important way that immigration status and workplace rights and conditions intersect is that we have a lot of occupational segregation in this country by immigration status, and part that's related to some of the history that Enrique was just talking about. And when we have a health insurance system in this country that is primarily based on employment, and when certain employers in certain industries and for certain occupations are a lot less likely to offer job-based coverage or less likely to offer affordable job-based coverage, it means that immigrants tend to be more left out. Another intersection is Annabelle alluded to with our work is I think the public charge rule is a good example of how immigration policy has ripple effects into work, into labor, into healthcare, and that's something that we've done research on as well, the impacts of the public charge rule in California. Just to the point of why US-born workers should care about policies impacting immigrant communities, I think, it has always been true in healthcare that we should all care about the health of our neighbors and our coworkers and our the families at our kids' schools, and their health impacts our health. But I think the pandemic has really just made that even more clear to everyone that our individual health is really intertwined with the health of our communities and our broader state and country. I'll leave it there.
Thank you very much, Laurel. And that opens up the space for Nari's perspective on the intersections.
Yeah. So, I'm going to start from sort of backwards, which is why should sort of, U.S. citizen workers care about immigrants, particularly in the arena of retirement security. The biggest programs that we have in the United States to make sure old people can get by is our Social Security and Medicare. And it's a pay-as-you-go system, right? And so a lot of countries have something like Social Security. And one of the reasons that the US actually isn't, despite what despite the Republican talking points on this, Social Security is not going bankrupt. It's actually a really strong system. And the US Social Security system is actually much better off than other countries precisely because we have immigration, because in some ways, imperfectly, but we've done a much better job of economically integrating immigrants than, say, certain European countries or Asian countries, right? We're all in the same boat because of declining fertility rates. And these systems are not sustainable without sort of a growing labor force. And honestly, without immigration. So the entire US sort of, essentially economic security for seniors in the United States is, I would say, largely dependent on continued immigration. to help sort of, bolster the workforce that actually pays into the system, right? And at the same, and another kind of point is that as we have an aging population, there's more demand for care work to take, elder care. And we're moving from a hospitals or nursing home-based system into a community-based system, saying that seniors should be able to age in place in their own homes. And the workers, about 60% of the workers who provide this labor, are sort of workers and immigrants, workers of color and immigrants, and also women. So again, this is a particular aspect of aging where, an immigrant labor force is extraordinarily important. And at the same time, we have, real issues with labor standards in that sector in terms of having very low wages and benefits. And so we're having a national conversation right now about the fact that we need to compensate this work. This is valuable work, socially necessary work, both in childcare and in elder care, and that in order to have the quality of care that we need and the number of workers that we need to be paying better. And immigrants are really central to that conversation. So I will stop here.
That's fantastic. All of you have laid out a broad overview of why we need to pay attention to these issues from different perspectives of your work. So now that you've piqued our interest, we would like to know more. Can you please share more specifically about what you are currently involved in, how your work relates to the conditions and policies that impact the immigrant communities, and also what are the projects or gleanings that you have taken from your long engagement in these areas of work?
Same order, Anibal? Great. So our work in particularly around high road training partnerships advances high road models of workforce and economic development that are grounded in worker, industry, and community partnerships that have the capacity to advance equity for historically disadvantaged communities, support a just transition to a climate positive economy, and improve job quality in firms, occupations, sectors, or across regions. Historically, the U.S. system of workforce and economic development, both public and private investment, has really failed to invest in low-wage, undervalued occupations. And it's really struggled to build effective pathways into higher quality jobs for excluded and marginalized communities. High road work, both at the policy and the practice level, seeks to change that system of workforce and economic development and change it from one that's oriented from a sort of an any job is a good job perspective to an approach that focuses really on increasing the quality of jobs, especially in low-wage, undervalued sectors. And also to change it from an orientation where you fix or train the worker to fit the current economic system that is frankly failing most folks, to one that changes the system to support high quality work, a clean economy, healthy communities, and all of the work adjacent supports that requires. So because immigrant workers are vastly overrepresented in undervalued jobs, as I think Enrique, Laurel, and Nari all pointed out really very well, they are disproportionately impacted by poor climate policy, by industrial pollution, by failing infrastructure. This work has the opportunity or the capacity to significantly impact immigrant workers and improve the quality of life in immigrant communities. Many of the programs that we work with are in those sectors that my colleagues called out: care work, agriculture, service work, those kinds of things, healthcare, hospitality, tree trimmers, sort of a broad swath that really affects immigrant workers. And there are significant policy challenges all throughout the system. I'll just touch on a few to kind of, continue to pique interest. Some immigrant workers, as a result of federal policy, undocumented immigrants, are excluded from some workforce system programs, just flat out excluded. In California, folks have done some work to mitigate that, but federal policy blocks some participation. Policies like public charge, which has come up, I think, in all of the many of the comments, can really be an intimidation tool to prevent workers from accessing even those services that they can access, right, that are open to them. So there are policy elements sort of throughout the structure of the system. The data system, something that we don't always think about, but just having to put certain personal data into a public system, if you're somebody who's already at high risk, is really intimidating and challenging. And the data system isn't even set up to measure the impact on equity, particularly for immigrant workers over the long term. So it's really challenging for us to even measure whether the investments that we do make are effective for our immigrant brothers and sisters. So that's just sort of a tip of the iceberg. There's more, but I'll leave it there.
That's great. Thank you very much for highlighting challenges that occupy you and your team. Enrique?
Thanks, Annabelle. So yeah, the low-wage work program, like I mentioned before, over the last year and a half has really been trying to understand and document the effect of COVID on low-wage workers and on essential workers, because so many of those essential workers are low-wage workers. And I think this is really valuable work that my colleagues in the program have done. They put out a report in 2020 looking at the essential jobs in California, like a profile of their worker characteristics. And in that report, they also looked at immigrants and, the top essential worker occupations in California are talking about farm workers, food prep workers, construction laborers, cooks, personal care aides, truck drivers, right? Farm workers, over 80% of those workers are immigrants. In food prep, 55%. In construction, 55%. Cooks, 54%, right? So immigrants are a big part of essential workers. And because these jobs are also low-wage jobs, the quality of those jobs is low, and the precariousness of those jobs is high. And so, like Pam mentioned, a lot of these jobs have, no benefits, healthcare benefits, or paid sick leave. It makes it really hard for workers to social distance because a lot of these jobs require to be in close contact with a coworker or with a customer. So there's still a very high risk of the pandemic on this worker. So we're still trying to understand the conditions for those workers. And then again, if you look at undocumented workers, it's much harder to even obtain that data. The report that I'm mentioning used American Community Survey data, and that data tends to really undercount undocumented workers. And so these numbers would probably be even higher if we had actual reliable data on undocumented workers. So that's some of the work we're doing in the Labor Center. Before I joined the Labor Center, I worked for an organization called Unidos US now. It used to be called the National Council of La Raza, and it's the largest Hispanic civil rights organization in the country. And I was the senior advisor for economic and employment policy, and we did a number of studies. One relates to Nari's work. We had a grant from Prudential to get a sort of a state of retirement for Hispanic workers. And then we also did a study of the Latinos who were unbanked. And not surprisingly, most immigrant Latinos are unbanked, meaning they don't have a traditional bank account. And that restricts their ability to not just save, but also tap credit markets for loans to improve their human capital education that will improve their work opportunities or their children's work opportunities. And so because of that, they have to rely on predatory type lending, like, payday loans or paycheck advance type of loans or card title loans. And then they get stuck in this debt trap that just makes their economic situation perpetual in many ways and generational. And so we try to come up with policies to mitigate some of those things and working with some of the partner organizations. And some people are really creative and they really try to do a good job of improving this. There's actually a organization in San Francisco who ended up establishing a lending program based on how some of these community lending things happen in Latin America called tandas, where people sort of pitch in as a savings account into the pool, and then that pool is used to make loans, and then those loans now can be reported to credit rating agents, the credit rating agencies to get a credit score, and so that improves the condition of those immigrants who might not be using a traditional bank. So there's lots of different ways where you can think of housing and healthcare and retirement and banking as siloed issues, but collectively they're all labor issues because they really affect the labor outcome of these immigrants. I think all the work we do in some way improves the immigrant worker outcomes, and by extension, non-immigrant worker outcomes as well.
Absolutely right. And that's essentially what we are trying to do in terms of breaking down, I think, the silos of issue-based work and trying to look at how to address these policy questions collectively as a movement. Laurel, would you like to address this question?
Sure. So I'll focus on one area of our work in the interest of time. A lot of our research is focused on who continues to lack health insurance in the state after the Affordable Care Act and quantifying that. And our research has shown that undocumented workers or undocumented Californians more broadly make up the largest group of uninsured in the state. And that's been a focus of our research with our colleagues at UCLA. And that's, as I've alluded to in previous comments, like because undocumented folks are excluded from both Medicaid and the Affordable Care Act under federal policy, and undocumented workers tend to work in jobs that are less likely to offer job-based coverage. And so our research has not only focused on the problem, but also the potential state policy solutions. And since 2014, every year in the state legislature, there's been a proposal to expand Medi-Cal to all low-income Californians, regardless of immigration status, which would be a huge step forward because about 2/3 of undocumented Californians meet the income criteria for Medi-Cal and would be eligible but for their immigration status. Unfortunately, as a result of a lot of great organizing work in immigrant communities and led by organizations like the California Immigrant Policy Center and Health Access, the state has made progress on this in the last 5 years or so. In 2016, Medi-Cal was expanded to all children, regardless of immigration status. In 2020, to young adults up to age 25, and then starting next May, undocumented adults ages 50 and up will be eligible for Medi-Cal if they meet the income criteria. And additionally, our state has also made folks with DACA eligible for Medi-Cal if they meet the income criteria. And so we've done research on, how many people would benefit from these expansions, how much it would cost the state, and really trying to show that the state has actually already paying for the most expensive services because low-income undocumented Californians are eligible for emergency services. It's really the preventive and primary care and care for chronic conditions that people are missing. And we've also really tried to to just show the need for these policies and who would benefit and how. Um, as mentioned earlier, we've also done research on the public charge rule and the impacts in California. We've done research on the healthcare needs for Californians with DACA, and I'm happy to talk about those other areas of work in the Q&A if of interest.
Thank you very much, Laurel. Nari, retirement.
Yeah, so I just want to give a little background. So to start off, right, I think I said that most workers in the US don't actually have meaningful retirement security. And so a lot of my work over the last 10 years has been, working on policies to help sort of fix that. And one of the things that the states are doing, including California, they started up an automatic retirement savings account system for workers, employees who don't have access to, a pension or a 401k at work. And so one of the things, so in California, about 45% of the eligible population is Latino. And one of the issues is that for the undocumented population, it's actually really hard to access the program. So it's been interesting in this and other areas sort of diving into basically because there are so many exclusions, right? Both in terms of, from the labor market and also from different social insurance systems and benefit systems, like based on whether you're documented or not. Trying to come up with like programs to actually serve the population gets to be really challenging. So for instance, right, with the state-sponsored program, you have to have a social security number or an ITIN to sign up. And so when people design a program, they said, great, at least we can have people with ITINs. And it's actually probably less than half the undocumented sort of employee workforce that actually has an ITIN. They have to be renewed every few years. It's a pain. And so similarly, during the pandemic, right, immigrants, right, undocumented immigrants were also, particularly hard hit by all the industry shutdowns, right, in sectors like restaurants and hospitality. And so while workers who are documented or citizens were getting all kinds of like pandemic unemployment assistance or supercharged unemployment benefits, the stimulus payments, undocumented immigrants weren't getting any of that, right? And so the state actually had a golden state stimulus, but again, you had to file taxes and have an ITIN in order to actually get those payments. And so there are just all kinds of barriers. And so I'm currently working on a policy brief with that got jump started with a Dream Summer intern, right, just this past summer, on sort of the challenges facing immigrants in general and undocumented immigrants in particular, and trying to accumulate, right, and have sort of benefits and retirement assets in order to have a secure retirement. And, another example is that if you don't have, right, if you don't have social security number and ITIN or something, you can't buy a home. And the fact is, especially in the Latino and Black community, home equity is actually probably going to be a much larger share of the retirement wealth that you develop compared to something like a 401k or an IRA. So, the community really tends to sort of put a lot of stock into home ownership. So if you don't have access to that, that's another thing that you're cut out of. In terms of things like the public charge rule, that's had a chilling effect, even when seniors have, right, both sort of documented and undocumented seniors have access to, say, Medicaid long-term care services, it gets to be a barrier because they're worried about then dinging their children, right, in terms of their possible sort of legalization if they wind up using these benefits, even if on the books they're not actually, it doesn't actually count towards the public charge rule, that it can actually still have a chilling effect. So yeah, so there are all kinds of barriers, right? Everybody, we have this principle in this country that if you work, right, that you should be able to retire in dignity when you're no longer able to work. And at the same time that we're counting on immigrants to, to fund things like our social security system and Medicare, we have put a lot of roadblocks in the way to, for instance, in California, our principle of being able to, retire in place. That for a lot of undocumented immigrants, it actually means basically being, if you don't have children to care for you, you basically have to think about going back to your home country if it's safe to do so and practical to do so, because there are just no resources here.
Well, all of you have pointed to barriers, exclusions, policy challenges that can address those. And it seems rather staggering. We have a question in the chat, and I'd like to broaden that up. The question is about data on immigrants as early childhood education workforce, particularly during the pandemic when this workforce was considered essential. Now, broadening up that question, and I first should answer that by saying our colleagues in the Institute for Research on Labor and Employment, where there's a center dedicated to the study of childcare employment, would be the most appropriate center to actually answer that question in terms of specifically that workforce. Although I would like to allow our panelists also to speak to that, if they would please address the broader question of data and how that itself is problematic in terms of addressing the challenges that you have outlined in your responses to the previous question. Does anyone have anything to say about the data collection?
Yeah, I just had a quick thing. So, it depends on whether you're looking nationally or in California. So nationally, the childcare workforce is mostly white women. But there's a slightly larger share of the childcare workforce that's immigrant, especially in the home-based portion, which is the bulk of childcare in this country is not through daycare centers, it's through home-based childcare. And so that's about 17% versus 13.7% of the general population that is immigrant. In home care, it's a lot higher. 25% of the home care workforce is immigrant. So those are national statistics. If you look at California, you're going to see much higher numbers on both counts, right? Both home care and childcare in terms of immigrants providing care services.
Thank you for raising that. And I also would like to highlight the work of the California Domestic Workers Coalition and all the different organizations affiliated to the coalition that have been trying to quantify this workforce separate from other services that the domestic workers provide. For example, to disabled and the elderly people in private homes as well as in residential care facilities. So it is difficult to quantify a workforce because of the different occupations and occupational codes that they would fit under. And often the immigrant workforce also remains invisible, right, below the radar screen because of the fact that some of this work is not even reported in many ways. Anyone else want to jump in on the question? I see Enrique wanting to say something.
Yeah, I just wanted to say that in the 2020 report on essential worker characteristics from the low-wage work program, we do have personal care aides included in the breakdown by nativity. And for California, this is 2018 data. And personal care aides, about 45% of the workforce was immigrants. So like Nari said, in California, it's much higher than nationally. Just in general data, at the center, we started a work group to look at how the pandemic has affected the various data sources that we use, because a lot of these sources are surveys and done by the government agencies, particularly the Bureau of Labor Statistics and the Census. And because of the pandemic, they also had to collect the information differently than other years. And so there's the unfortunate thing is, like a lot of the 2020 data, it's to be determined whether the quality of the data is good enough to be able to do the kind of studies that we've done in the past. For example, we use the American Community Survey a lot. The Census Bureau decided not to release the traditional 1-year ACS because the response rate was really skewed to our higher income individuals, and there was no way to really adjust for that. And so in December, I believe, and Nari can correct me if I'm wrong, they're going to release sort of like a special version of the ACS where it has just some data, not all the data, and a lot of it is imputed and so are modeled. So there's for researchers like us who rely on this data, there's a big question about all the different data sets that we use, whether they allow us to really look at the information for our programs during the pandemic, or we may have to wait till 2021 or try to use some other data source that we typically don't use. And then we talk about undocumented workers. That's the data there is usually pretty thin to begin with, and then again with COVID, it's really difficult to assess their condition as much as we'd like.
I just want to echo that it's a mess in terms of data. There's an entire wave of 1 year's basically 1 year's worth of data from a wave of the survey on income and program and participation by the Census Bureau, which is one of the basically, it's really the only survey that really looks at assets for low income households. And they basically said, you probably don't want to use this particular data set to do any sort of demographic like race analysis because the response rates are so low, right? So yeah, it's just been, I think, really challenging if you're trying to do research on the impact of the pandemic, but the data, a lot of the data collected during the pandemic, it's the quality is not as good. And I just want to point out that we're also going through this whole redistricting process in the state of California. And so if you remember a couple of years back, there was this whole fight over whether or not the Trump administration was going to insert a citizenship question, but that actually had still, even though that didn't go through, it still had a sort of chilling impact on some of the response rates. And that's the data that is actually being used to, redraw political districts right now. So data is important.
And what you're pointing out is even more severe. It seems like the workarounds that we have had to use in the past for the undocumented but also unreported conditions that immigrants are facing won't hold true because of the pandemic. So it's a double whammy, really, isn't it? That the immigrant workforce is hit by the pandemic in so many severe ways. And then it's also difficult to actually highlight their stories or their cases because the data is missing on that situation. But that is very significant in terms of answering then the next question, which we could go into. How does the pandemic then pose even more severe problems in your areas of expertise? And joint, because we're running out of time, what are the big policy fights that you think we are looking at in the next couple of years? And we can go in any order this time.
Yeah, I think for us, we're lots of questions about what the recovery is going to look like for these workers, and whether they will benefit, whether immigrant workers, especially undocumented workers, will be able to recover as fast as other workers, or will they lag for quite some time? As Pam mentioned in her initial comments, many of these workers were not able to access a lot of the programs that were put in place to help workers during the pandemic, and so they haven't had the lifelines that other workers have had. I actually just did an interview yesterday with the Wall Street Journal, and they wanted to talk about day labor. And obviously, not all day laborers are undocumented, but a good portion of them are. And the work dried up during that pandemic, and a lot of the work centers that had to pivot and became really care centers, where they started to provide food to these workers, raise money to provide cash assistance to these workers. Became vaccination sites and testing sites, and had to pivot to doing, English as a second language classes over Zoom, and they really became care centers for these workers, and they're not seeing the light at the end of the tunnel yet on this. There are some workers who are a lot of the construction jobs have come back. We hear about the labor shortage in the news, but really, a lot of that labor shortage is in the front of the house of restaurants, waiters and hostesses and so forth. In the back of the house, dishwashers and cooks. They're finding workers. A lot of these workers are day labor workers who've pivoted, and other immigrant workers. But daycare, that was a big part of some of the day labor workers, and that's still pretty much dried up for them. So, just if you think about day labor, there's a whole set of research questions that we would like to explore, and that's just one aspect of this much larger workforce. So for us, a lot of questions that need answers as we come out of this pandemic.
And Enrique points out, sort of both the challenges and opportunities, I think, really well. I think that's really important. So I'd like to turn your question on its head a little bit and point out a couple of instances in which largely immigrant workforces, because they had access to the social capital that's provided by a rich infrastructure through a high road model, were able to at least have better outcomes through the pandemic than they might otherwise have. And I'll point out just a couple. For example, in the hospitality sector, that was frankly decimated right during the height of the pandemic, 90% unemployment across certain unions and more in certain whole occupational elements of the sector. But in Los Angeles, the Hospitality Training Academy used its network to work with its signatory employers, open up big industrial kitchens at the Staples Center and other places, and put a whole bunch of workers back to work, continue training, and use their work to feed the community, feed seniors at risk, feed unhoused populations at risk and others at risk, and really made a huge difference while continuing to maintain social capital among the communities where they worked. In the case of the healthcare field, with the education, with the Ed Fund, an SEIU partnership with a variety of hospital systems, we're able to get workers to articulate what was going on in their workplaces and bring resources to bear to support that, to keep workers safer. Also continue to support workers in pivoting to online training, distributing computers, getting people set up in different ways. So again, really helpful work that was a result of that social capital that perhaps one could argue we as a country should provide for everybody. In the absence of that, these models tend to do that. And another real quick example is Building Skills Partnership, another SEIU project with their signatory employers, who works primarily with janitors, people who clean the sort of huge buildings and variety of buildings, but a lot of the big high rises. Immediately went into action and developed with their workforce, with their workers and with their employers, an infectious disease training program for the janitors that work in those buildings, the building services staff, that not only supported the safety of the workers, again, hugely immigrant centric workforce, but also allowed the building managers to increase the public perception of the safety of possibly coming back into those buildings. So it was a win all around. So if we do it right, and we have an opportunity now to do some things differently, if we can change policy in the right way, there is hope for better outcomes.
What wonderful examples. That's wonderful. Thank you very much, Pam. Enrique?
Yeah, so I would be remiss if I didn't mention that a big part of our work also is not just helping to implement labor standards, but also ensure that the ones that are already in place are enforced. And we still have a lot of instances where employers try to get around those labor standards. So the issues of misclassification, classifying workers as independent contractors instead of the actual wage employees that they are, wage theft, you see a lot of instances in wage theft, especially within immigrant workers. So those are things that continue to be a challenge and issues for us to work on to help improve those outcomes as well.
That's great. So you're talking about both so far about setting up a social infrastructure that works and expanding that so that immigrant workers can be served in the ways that they need to be served, in whether regardless of the sectors and occupations that they are in. Any closing remarks that you want to make about how students may be able to plug into the work that you're doing, or work that you might be building so that students who are interested in contacting you might be able to look forward to engaging with you further?
I just wanted to offer that any students who are interested can reach out to me if they have questions about our work. And also suggest that, the California Immigrant Policy Center does a really great job of tracking state level policy related to immigrants, and may also be a way to get involved. So just wanted to mention that.
Thank you very much. So with that, we will close the session. I want to thank our panelists, Pam Egan, Enrique Lopezlira, Laurel Lucia, and Nari Rhee, for joining us and sharing their work in different areas that they are engaged in at the UC Berkeley Labor Center. Thank you all for joining us, and please feel free to look them up on our website.